I am Dr. G.V.S. Rao, ENT surgeon, director of Dr. Rao's ENT super specialty hospitals. We are doing ear as a super specialty in the India, and here I want to say something about this climate, this weather. Nowadays it is very cool in the most of the parts of the India, and how the cool weather affect the ear, nose, throat, and what are the precautions we have to take to lead to pass on this weather to the next season of the year. Especially first we will come to the ear, nose, throat. In that ear, nose, throat, we will think about the ear. Most of the people, whoever comes in this season, they comes with a severe pain in the ear because of the season. And what will happen in this cool weather and cool season, usually we will get cold, and whenever we get a cold, we will think about only the nose. It may be running nose, nasal discharge, nasal stuffiness, or nasal block, and whatever you say, unable to breathe through the nose and difficult in breathing, then going for the ear problems and throat problems. And you see, whenever any problem comes in the ear, because the pain is very sensitive and the pain we can't tolerate, and most of the people in this season, they comes with the ear pain, and when the doctor is examining the nose and throat, not only the ear, they will ask immediately. The patient may ask, why doctor, I am telling the pain in the ear, but you are examining the nose and throat, and they will forget about the interrelations of the nose and throat along with the ear. The ear has a small connecting tube between the ear and nose, that is called eustachian tube. Whenever the weather changes, it may be the cool weather or other weathers, what will happen, especially the cool weather, the tube, which is very small in size, that tube gets blocked. Usually everyone thinks whatever the air from the outside that goes into the external aortic canal touches the tympanic membrane, that goes into the middle part of the ear, that is called middle ear. That is not correct. The air, whatever we are breathing through the nose, that should go back part of the nose from the small connecting tube, the eustachian tubes, into the ear. Whenever the nasal obstruction is there, nasal block is there, and automatically the ventilation to the middle ear will come down. And once the ventilation to the middle ear comes down, there is a negative pressure that gets created in the middle ear. And not only the negative pressure, usually whenever we are talking, continuous salivation will be there. When salivation is there, then only we can open the mouth, we can talk, our tongue will move in the mouth, and we can talk fluently also, we can open the mouth also. Like that, to get good ear function, the functions of the ear, one is hearing, second is the balance. Not only whenever the stuffiness of the nose is there, when the tube gets blocked, we immediately will get a feeling of block in the ear. If the block in the ear is not because of that problem, we are not unable to meet the doctor, we are unable to take some precautions. I will tell the precautions at the end of this speech, and I will tell the how to take care of this season. See, whenever ear block is there, you are unable to meet the doctor in time, what will happen? There is a continuous secretions in the middle ear. There is a fluid, some fluid will get secreted, the cells which are in the ear. That fluid and air helps to transmit the sound vibrations into the inner ear. We can hear the sound. Whenever there is a ear block, that indicates that there is a negative pressure in the ear, the tympanic membrane is not moving. Not only that, added to that negative pressure, what will happen? There is a collection of the fluid in the ear. So there is ear block, there is a collection of the fluid in the ear. Ear block, when there is ear block, we are unable to meet the doctor, we are unable to take some precautions. When there is still the block become more and we are unable to meet the doctor, there is a negative pressure, there is a fluid accumulation. If we leave like that, what will happen? The entire body has bacteria. If the body resistance is good, nothing will happen to your ear. The secretions and everything will come back to normalcy. The tube will get open. Once the tube gets open, what are the secretions in the ear? That from the tube it comes into the back part of the nose, and that will get swallowed whenever we are swallowing like this. So if the body resistance is not good because of our climatic conditions, and the body resistance is not good because of the body resistance and everything, the power of the resistance of the body. What will happen? The bacteria in the middle ear, they will start growing abundantly in that fluid that got blocked in the ear. So whatever the fluid is there, that is sterile fluid, when the bacteria starts growing in the fluid will be get converted into the pus. When there is a pus, the bacteria is abundantly growing, the volume of the pus is growing up in the middle ear. The space of the middle ear is covered on both sides with the bony walls. Only one side, the tympanic membrane, is there. The tympanic membrane is very sensitive. The space is very less. When the fluid is coming and touching the tympanic membrane can expand. It become bulged. You see, it can become bulged to only some certain extent. After that bulge, and you may not be able to tolerate when the pressure of the fluid pus is happening on the tympanic membrane. At one point you can't tolerate the pain. With that pain, we will consult the doctor. The condition is called acute suppurative otitis media. So if still in that point of time, at any cost, if you are unable to meet the doctor and take some measures to prevent the rupture of the drum will break open and rupture. There is whatever the fluid, the pus got collected in the middle ear, that comes out. When the tympanic membrane ruptures, the blood vessels in the tympanic membrane also get ruptured. Along with the pus, there is also getting the bleeding from the ear. So the pain, unable to take the patient to the doctor. When the rupture of the tympanic membrane, the blood-stained ear discharge, pus coming from the ear, then they may get the red signal and they may rush to the doctors. And so these are the precautions. Even if you think your hearing is not normal because of your weather, if you think the ear block is there, the ear block, with your home remedies it is not coming to normal, better to consult the doctor and take treatment in a proper time. And see, sometimes it's to expose to the cool weather, and some people, the ear canals may be very sensitive. When the ear canals are very sensitive, some people, they used to use whatever the commercially available buds they try to clean every day, like brushing the teeth. It is not advisable, and don't use the buds. The skin of the external canal is very sensitive. Behind the skin, very thin, the thickness of the skin is very less, and behind the skin there are sensory nerve endings will be there. The nerve endings will get stimulated, and in the few days when you start cleaning, you may get some type of pleasure, giving some pleasure by cleaning the ear. After some time, the nerve endings will get exposed. If you keep a bud, your ear cannot allow you to keep the bud in the ear. So these type of situations, even not the bud, and if the ear is becoming so sensitive to the cool breezes, sometimes there is chance of getting giddiness also. So such a type of situations are there. Please try to wear small cotton in the, whenever there is a constant pain, some constant type of itching in the ear, some constant type of irritation in the ear, please keep a cotton wool and don't get exposed the ear into the cool breezes. And like that you can take the precautions. And whenever you feel the cold, the stuffiness of the nose, please try to take some care for the stuffiness of the nose, then the ear will get cleared. So what to do in this type of weather? There is a nasal block, continuous water nasal discharge. It may not happen to all the people. It will happen to the people who are getting exposed to the cool breezes because of their professional activities, or because they have to run in that cool weather in the early hours and all. And there is also getting not only the nasal discharge, the stuffiness of the nose or nasal obstruction, difficulty in breathing. If it is not addressed well, the nose, if the care is not taken for the nose, there is chance of the infection going to the lungs, and the lungs also may get affected. And to avoid this, better to wear a mask like this. Doctors, how they wear the mask, like that you can wear the mask so that the cool breezes may not go into the sinuses like that. See, you have to keep in mind the functions of the nose, not only one, breathing, second is there is a smell. To protect the nose, its functions, there are 3 turbinates for this side, and there are 3 turbinates on this side will be there. The turbinates are fleshy masses in the nasal cavity. The function of the turbinate is to air condition the air that goes into the lung. So what will happen? When the cool breeze is going into the nose, the turbinates, they try to control the air coolness. See, if it is very cool, then the body temperature, the turbinates immediately that turns the temperature of the air that is going into the lungs, and it will be supplied to the lungs at body temperature. That is called air conditioning of the air going to the lungs. The lung cells are very sensitive, and unless the turbines functions very well, the lungs may not be able to tolerate the coolness or the high temperatures of the in the summer, and the cells will get damaged. So the nose is a air conditioning chamber. It prevents that reaching the either cool breezes to the lungs or hot breezes to the lungs to protect the very sensitive cells in the lungs. Here, see, suppose if you are unable to tolerate, sometimes you see some people, of course may not be all the patients, all the people gets some problem with the exposure to the cool. Who are very sensitive to the cool, they will get exposed. Whenever they get exposed to the cool breezes and all, they are the sufferers. So if you are not happy with the cool breezes, you can wear a monkey mask like that, and so that you may not allow the airs into the lungs and nose. Right? From the nose to the lungs also, you can avoid the breezes going to the nose and sinuses and lungs. So like that you can take. So okay, where to do work in the cool atmosphere, what to do? You can protect your nose, you can protect your ear, you can protect your head also with a muffler or a mask type of things. Even still you are not happy with these things, then you can supplement your body with the hot beverages. Whatever the hot beverages, it is not affecting your mind and body, you can take that hot beverages. And if you take the hot beverages, and so that the body will get heated, and your face and everything you can feel very hot, just like that you can escape from the cool weather and cool season.